Hello, everyone. My name is Tanner Menard, and my pronouns are they, them. And this is Health is Queer Resistance, a production of Equality Arizona. Health is Queer Resistance was started by myself and Dr. Katie Miriam in August of 2019 as a way to center the well being of the LGBTQIA plus community. We lead discussions on wellness, nutrition, affirming healthcare, and do it yourself tricks for maintaining a healthy lifestyle. In a world where the queer and trans community are often unable to attain health insurance or affirming health care, empowerment to achieve good health is an act of queer resistance. During this month's installment of Health is Queer Resistance, we joined by our regular host Katie Miriam, and we'll be discussing Equality Arizona's wellness survey, as well as just kind of reminiscing about what we've done with Health is Queer Resistance. We're very concerned about the health of our community in these challenging times, and we hope that you will join us in filling out the survey so that we can better serve our community. We're joined by Equality Arizona's digital organizer, Jean Woodenberry. Before we get started, this year Equality Arizona is asking for donations to help 10 queer families in Arizona. If you're a queer individual or family in Arizona and in need this year, or know folks who are, email Louisa at equalityarizona.org, and our producer, Jean, will post the links to donate and information about how to contact our organization if you need help this holiday time. And also, we'll be posting links to our survey. Hi, Katie.
Hey, can you still hear me?
I can still hear you. It's good to, we're using this new platform that I'm very excited about. And, just like any technology, there's always going to be little technical issues. So I apologize that we started a couple minutes late while we did that. But it's good to see you. How are you doing today?
It's good to see you too. I'm well. I'm planning on, this was the last day of work for me this week, so I have a day off tomorrow and over the weekend, and I'm looking forward to that. That was my fault, everyone, for the technical difficulties, but I'm glad we figured it out.
No, we are, I feel like in so many areas of the work that I do, because I am a graduate teaching assistant, and then I work with Equality Arizona on this, and I feel like we're exploring in an unprecedented way
Yeah.
the work that we do. So it is what it is, as they say, and
Yeah.
yeah. Um, yeah, I'm excited. I'm happy to be here again, and I just thought that for those people who may just be joining us, it's the end of the year. We've been doing this for about a year and a half now, and I was wondering if you could just kind of talk about, what Health is Queer Resistance is, what we've and what how it's done, how we've evolved, and then also maybe just like a recap in your mind of like the kind of things that we've covered and the kind of service that we've been during this pandemic.
Sure. Yeah. I can't see anybody else, of course, besides you, but hi, everybody who's on streaming and watching through Facebook Live. My name's Dr. Katie Schneller. My pronouns are she, her, and I am a naturopathic physician working out of Chandler, Arizona. Tanner and I started this group. Well, initially, the only reason we met was because I came across a Facebook event called Woke Queers and Coffee or something like that. And I loved the title. I didn't know anybody in the group at all. I just showed up to this coffee shop in Tempe and started talking with what happened to be a number of organizers for Equality Arizona. And we got to talking and decided, within the next month or so to create an event. And Health is Queer Resistance is the name that we came up with. And I think that resonated with, both of us at least, but everyone else who was involved at the time, because in my opinion, the way to improve your health and optimize your wellness is through education. And
Hmm.
that's something that I'm really passionate about with my patients. I don't just give you treatment plans and tell you this is how it has to be. I go through your labs with you, make sure that you understand everything that's happening for you and your individual body. And we work as a team together to identify what you want to do. And so for our first talk, I remember it started out more as a PowerPoint presentation where I talked at everyone. And, it was just kind of sharing my wealth of knowledge on some tips that can help keep you well on a budget. I think was the first one of the first presentations that we had. And at the time, of course, we were all live and still in person. And we met at Pomegranate Cafe and we talked about a number of different things. And then we met at the studio that Equality Arizona works out of, the McKinney, right? I think. And it was that place is lovely. And we even had the opportunity, I did, to teach yoga once after one of our sessions. So really throughout time, we've hit a number of different topics. Let's see, the last few ones I can pull up on my calendar here. So last month we talked about bodily autonomy. The month before that, let's see, what did we talk about the month before that? October, we talked about yoga for people of color. And the talk before that, we talked about sex work and health. So we've hit so many different topics. Health is Queer Resistance has progressed massively, I think, from the way that it started. And we've been able to have people of all sorts of different experts on different specialties and talking about everything that they know. And I've loved being a part of it and having the opportunity to talk about my side, but also connecting with so many people in the community, queer, trans, everyone from the spectrum, about what they love to talk about and what everyone's passionate about, and helping everyone stay connected and understand themselves better. So that's, anyway, long story. That's what I think has happened.
Yeah, well, I mean, it's for me, it's been an interesting process to transition the work that we do to this video format. And I know that for myself personally, I've had some wonderful experiences working with platforms like Zoom, and I've been able to participate in things in my life that I wouldn't have had to been in New York for, or had to been in Paris for, or
Mm-hmm.
where, whatever it is. I've gone to so many workshops that I wouldn't have been able to go to, but I do miss being able to interact with people on a more personal basis, but I feel like we've been able to reach a lot of people. And one of the things that I'm really proud of that we've done since we've transitioned to this video format is that we were able to, early on in the pandemic, we were able to bring a lot of medical experts on board through this and provide accurate information to people about what's going on with the COVID-19 virus. And I think that has probably, I feel, because right now my parents have COVID. My roommate has COVID and is
Yeah.
quarantined right now. And it's just, it's a scary time. And I'm very glad that we've been able to provide information to the LGBTQ community. And I think, my thought when I started this program was that, I up until last year, I haven't had health insurance in 20 years. I mean, it's so inaccessible to most people in the United States, and the disparities in the LGBTQIA plus community are extra extreme.
Yeah.
Um, right offhand, I don't know all of the numbers, but I know that our community is really adversely affected by that. And so one of my reasons for that I was so excited to be able to work with you, Katie, is that, I've always relied on naturopaths. I've always relied on acupuncturists. I've had to do that. And I also believe that there's a lot that a person can do outside of the medical establishment to stay healthy.
Absolutely.
And that, I wanted to be able to provide medical experts and alternative health experts in the same format, so that people can look at health from a variety of different perspectives.
Mm-hmm.
And I think that one of the things that's really missing, and one of the things that we're working on at Equality Arizona is, we were living in such a polarized time. How do we have discourse again? How do we have discourse again from different viewpoints?
Mm-hmm.
And I think that it's the work that we've been doing has been really innovative in that regard.
Mm-hmm.
And I would like to just acknowledge Linda Lewis on Facebook says, "Thank you, Quality Arizona, for all you do." And thank you, Linda. I really appreciate you saying that, because we're just a few people
Mm-hmm.
that do this work, and we really rely on volunteers. And then Aaron says, COVID-19's been bad, but I'm glad it wasn't Ebola or something instead. It's true, but I saw this infomercial the other day, and it said it was showing, the biggest death rates in the United States, like the biggest one-time death rates, and the highest was the Galveston hurricane, 5,000 people, and then under it was 9/11, and then below that were every day this week.
Mm-hmm.
Think about that. You know what I mean? Like, this is really serious. Like, every day right now, 3,000 people or more are dying
Mm-hmm.
of this disease in this country. It's really, really terrifying. But I feel like part of what we're encouraging people to do is to stay resilient, and we provide people with opportunities, even in the digital format, to mobilize. And that's probably, when we think about health in the queer community, we have to think about it from a political, we don't have a choice but to think about it from a political point of view, because politicians are making decisions for us about that impact our health, that impact how we receive health care, that impact the way we receive health care. For instance, I think that it's difficult if you are a lesbian, gay, or bisexual person to have to divulge that information. But if you're a member of the trans and non-binary community, it can be a life or death thing. And for anyone out there that may have experienced that, I apologize if that's a sensitive topic, but it's one that we've covered, because part of the work that Equality Arizona does is to confront lawmakers and confront the laws that allow that sort of discrimination to happen in hospitals. And that's why it's so important that if you appreciate our programming and you appreciate the work that we do, that you actually get involved. Jean will be posting links in the chat on all of our forums, so you can see our website, you can see all the different ways. There's a volunteer page that Jean will be posting, and I encourage you to just go there and sign up for something. Like, if all you can do is some kind of a digital event with us, if you can donate, if whatever it is that you can do, we really appreciate your help, because we pretty much are the buffer between the LGBTQ community and the state legislature right now. And we actively work with legislators to pass the kind of laws that help us, and to fight the kind of laws that truly discriminate against us. And As um, we did well on the federal level this year, but on the state level, it's a pretty scary situation. And so the work that we do is super, super duper important. Would you like to? I've been talking for a minute. Would you like to add something to that, Katie?
Um, I don't think to the political piece, but absolutely, if you can volunteer, or bring friends to volunteer with you too, make a little day out of it if you volunteer for an event. But everything that's done by this organization is so important in the community, and there's really no other organization that I know of that does the breadth of everything that Equality Arizona does. And I've loved volunteering my time, and hopefully anyone else who's watching will gain benefit from that too. And of course, you're helping your community when you help the organizations that stand up for and protect the community. So, each person does really count, and one person can make a difference.
Yeah, absolutely. And the thing about it is that it's kind of like you mentioned when you started speaking earlier, that you just sort of saw an event. The messaging was resonating with what was going on at the time and the
Mm-hmm.
kind of language we were using in that moment. And you came and we talked, and this was birthed out of it. And I think that that's the beautiful opportunity that you have. I know it's a little bit more difficult now that we're all in quarantine, but
Mm-hmm.
if you're a creative person, if you're the kind of person who's been thinking, I've been wanting to do this thing for a long time, reach out to us, because there might be an opportunity for us to help you create programming alongside with us, um, and to really contribute something beautiful to the LGBTQIA plus community. Um, I'd like to welcome Jean to the call. And what we're going to be doing tonight is we're conducting a wellness survey that, we're really concerned about our community right now. I mean, not only myself, I'm not just concerned about COVID-19 infections, but I'm concerned about people's isolation. I'm concerned about people's mental health. I'm very concerned about that. And
Mm-hmm.
I'm concerned about people's economic health. I'm concerned about small businesses. I'm concerned about all of the issues that people are rightfully very upset about right now. I think we can tend to start thinking in a very one-sided way, and there can be a tendency to sort of blame this side and that side for whatever. But we're in a difficult moment, and I just want to acknowledge all of the different difficulties that people might be going through
Mm-hmm.
right now. And so, hi, Jean. It's nice to see you this evening. Thank you for joining us. Thank you for managing the technology so well.
Thanks.
Um,
Yeah, I'm glad
and
to
I,
be here tonight.
yeah, tell us about what you do at Equality Arizona, Jean.
I do a range of things. A lot of what I do is just sort of managing the digital relationships that we have with our members, with our volunteers, with our partners around the country. This year, everything has moved so much into this online space. And so building out the platforms for us to be able to do our work and for us to be able to help the people that we work with has been pretty much a huge part of my role.
Um, can you tell us about the survey that you have created, and why we're hoping for people to fill this out, and why they should fill it out?
Yeah, absolutely. So let me actually share my screen really quickly. So it should be on the screen now. We designed a community wellness survey because we know that 2020 has been just like a devastating year for so many people. It's completely overturned, the routines that a lot of us had. It's changed our work environments. It's changed our personal relationships. It's changed just how we go about incredibly basic things. And in a little bit, when we walk through the survey, I'm going to bring that up as like a featured item.
Okay.
But we built this survey to get an idea of, we kind of know what we've been through, how we've had to change, but we want to know how you've changed so that we can be responsive to your needs, so that when we go out into this legislative session and we're working there, we know what people actually need. We know what people are actually going through. And when elections roll around later this year and next year, we can advocate for representatives who serve those needs and understand the queer community in Arizona. So we have this 4-minute survey, and let me pop that up into sort of a main view.
Gene, can you describe some of the things that you foresee Equality Arizona having to interact with the legislature about this year? Like, do you have any idea what you foresee, the kind of challenges that we're going to face this year, and the importance of us knowing this data?
I think it's not all going to be in the legislature. There's going to be some municipal actions taken at different levels. You're a little frozen, so I'm hoping that I'm not talking over you, but
You're not.
Okay, we're going to be looking at action taken at a lot of levels where we're going to be on the defensive. For at least the first half of the year, we're still going to be in recovery from the pandemic. And so it's going to be looking at how does Medicaid in Arizona actually serve trans people? How do trans students interact with the different services of their schools? How is coronavirus relief apportioned to different communities, and does it see the needs of those communities? So having this kind of knowledge of what our community is like and what our needs are like is knowledge that we can bring to the table in a lot of those conversations. And this year is going to be really defensive, but it's still knowledge that we can use to everyone's benefit.
Thank you. And I see in the chat that Aaron says, my needs are well taken care of by Medicare, etc. I want to help others. Aaron, if you go to www.equalityarizona.org/volunteer, please fill that out, because we are definitely always looking for help. So please go ahead and fill that out, and someone will reach out to you about how you can help with us. Okay.
So I have the survey spotlighted. How did you want to talk through this?
Okay, I think that what you can do is, if you just, everybody out there, if you go to equalityarizona.org/survey, you can find that in the comments and in the chat here on the live studio. Click on the link and go to this survey and fill it out with us. This is the first page that you'll see. If you click on yes, I'll help, then you will start the survey. All right, so just continue here. We're going to go through a few demographic questions. And here, you know, we're looking to see what your sexual orientation is. And, you know, that might seem like a personal question to some people, but the reason we're asking is because we'd like to know specifically, for instance, if you are a bisexual person, we want to see what are your needs as a bisexual person. And so that's why this is relevant. And then there's a question about gender, and it goes through through all of the different possible genders. If there is other, if you are other, if you do identify other than this, there is a way for you to record that information.
And as you're going through the survey, a lot of these multiple choice questions are designed so that you can choose as many options as you want. So what I've seen from a lot of surveys trying to understand like the impact of COVID is that they don't have a real understanding of, you know, an expansive understanding of sexual orientation and gender, and their list might include overlapping categories. Something I see all the time is questions that make you choose, are you a man or are you a trans man? Are you a woman or are you a trans woman? So this is really designed to choose everything that you would use to describe yourself.
Okay. So let's move on to the next screen. Okay, so the next question is, would you describe yourself as either Hispanic or Latinx? And that's very important information in the state of Arizona because we have such a large Latinx community. And it's important for us to know how this affects your community. Okay, so we go through this question about racial identity. And this is also very important because the number of people in your household determines a lot about your economic status, about your about how COVID infection might be affecting your household. For instance, right now, I'm in graduate school, so I have some roommates, and one of my roommates is actually quarantined on the other side of the house with COVID, and that's very relevant information for us to understand about what's going on and how we can help you. And then there's a question about your household income, your age, okay, and here we're just going to go through questions about COVID-19. So has someone in your home experienced any symptoms of COVID-19? So in my case, for instance, yes, someone in the home other than me. Have you ever been tested for COVID-19? Has anybody in this group been tested for COVID?
I have, yeah.
I have too.
Yeah, I am very fortunate because as a graduate student, I'm actually required to take COVID-19 tests. So I've taken them 3 times. I have not taken the nasal swab, but I do hear it's a little uncomfortable. I've taken the saliva tests, and I've gotten my results in 3 to 4 days. I personally had an incident where I had a student who came to class, and a few days later she tested positive for COVID.
Mm-hmm.
And so, you know, I'm a pretty healthy person, but I was concerned, so I went and got a test. And those are available to people. The rapid tests are available to people. So if you're ever in that situation, I can just, and you know, I worked in HIV for a long time, and I'm gonna say something that I'd never really admitted before, but I worked in HIV for like 5 years, and I was so afraid of taking that test that even though I should have taken them every 6 months, I would not do it. And I mean, the number of I wish that I had tested for HIV a lot more than I had, So I just want to encourage you out there, there's nothing to be afraid of. Please get tested for COVID as often as you need to. And especially right now, while the cases are so high, do it so that you can make empowered decisions about your family. Okay, so what's the next question, G?
Well, it will fork depending on if you say yes or no. But
Okay.
in this case, if I say no, it'll ask me, well, what are the reasons that you haven't been tested? If I say yes, let me just say yes. It'll ask how difficult it was to get a test.
Okay. And there may be differing answers for you depending on in my case, I'm able to just go to NAU and get a test. But there could be other people who have a harder time with that.
Mm-hmm.
We want to know. We want to know how hard it is for you to get a COVID-19 test, especially as members of the LGBTQ community. When we speak to legislators, we want to know how to advocate for you. Okay?
How many times do you think you've been tested? I've only been tested once, and mostly I've been pretty isolated, so I haven't felt the need to get tested again.
I've been tested 3 times.
Okay.
I've been tested twice, but the first time was for antibodies, and that was a blood test. And then the second time I was concerned that I was sick, and I wasn't. And I got the throat swab at my medical college.
We want to know, have you ever tested positive for COVID-19? We like to get an idea of how many people in our community, a percentage of how many people in our community have actually tested positive for COVID-19.
Mm-hmm.
That's something that's useful to compare to, larger known numbers of just the general population of Arizona, how many people have tested positive. If that percentage is higher, if that percentage is lower, and we have enough data to trust that discrepancy, then that could be a really meaningful conclusion.
Since February 1st, 2020, have you been hospitalized for COVID-19 or because you had difficulty breathing or a respiratory infection? Okay, now we're going to go on to how the pandemic has affected your economic well-being. And, this is an issue that I think that we need to be talking more about in this country because so many people are really suffering economically because of this. All of us here, I think, that have been okay, but so many people have not. And if you're one of those people, let us know this information because we want to know how to advocate for you when we talk to legislators. So we're really interested to know how your employment status has changed since March 1st, 2020. This is good information because the state, myself, I have to admit, I don't know exactly what sort of information the state is looking at, but we want to be able to present information specifically about our community. So let us know, are you still at the same workplace with the same number of hours? Are you working reduced hours? Are you working from home? Did you lose your job? Do you have a new part-time job, a new full-time job? Did you have to quit your job because you needed to take care of people? And I personally know people who have had to do this, or people who may have had a job where they just didn't feel safe because they were immunocompromised or for whatever reason, and they left. And I would just like to take a moment out there and say, if you are an essential worker, if you are in the medical profession, if you're an educator, if you're doing anything out there where you have to go to work, thank you very much for what you're doing and for the bravery that it takes to get up every day and put that mask on and go in there and deal with people. And we have someone in the audience that bringing up a good point that says, if you want to continue in the survey, can you choose A to indicate no change? That's a very good point. Thank you for bringing that up, Aaron, and thank you for interacting with us the way that you are, because this is the kind of interaction that we're hoping for. So thank you so much.
Right. So I would say that if your employment status hasn't changed, regardless of your prior employment status, I would just choose A in this survey to indicate that there is no change. Moving through the survey, there's a question of if you've experienced a reduction in income since the beginning of the pandemic, which is a yes or no. And have you received unemployment income during the pandemic? I've been following some of the journalism around unemployment benefits in Arizona. We're seeing another surge in applicants for that. But it seems like a lot of the applications are being denied and being kind of run through the machine in a never-ending loop. Can either of you speak to any further knowledge around that?
I have not heard anything from my personal circles about any issues with that. I remember what a massive cluster it was at the very beginning when everyone was applying for unemployment and how long it was taking. And, you have to once a week reapply. And so, but I haven't heard anything recently. Have you, Tanner?
I have not heard anything about that in Arizona specifically, but if there is anyone out there that has information about this, reach out to us. Leave a comment, let us know how we can get in touch with you. We would like to find out more information. I did get my stimulus check and I really enjoyed it. And
I think if there's anything this question really highlights, it's that there is one stimulus check we can refer to in a very singular way.
Yeah, it's really sad. I really hope that with this new change of administration that Congress and the president are able to give us the stimulus that we need for our economy and to help people out there who are really in need right now.
The most recent statistic I heard was that over 20% of small businesses had closed. I believe is what it was. And
wow.
Hopefully this doesn't get much higher than that. But
yeah,
it's been terrible.
Okay, so we're going to be going into stress. And I know that for myself, like right now, I'm going through a lot of stress. I am going through a lot of stress. And I'm sure that everybody else is too. So we're just, let us know, is it from little to no stress to extreme stress? Let us know where you're at.
For comparison's sake, we have sort of a looking back question. How would you have rated your stress before the pandemic began?
Yeah, I don't know anyone who wouldn't answer yes to this question, but if you're one of the few, congratulations, and that's amazing, and I'm very envious.
Yeah, so during this crisis, has your access to people most important to you changed? I know for myself, and I just want to say this like as, food for thought for everybody out there. Um, I have not seen my mom and dad in almost 4 years. I moved to Arizona from Louisiana, and I miss them very much. They wanted me to come home, but they got COVID over Thanksgiving because they decided to have a gathering.
Mm.
And I really wanted to go home this holiday, but I'm glad. I sat with myself and I said, I don't want to accidentally harm my grandmothers. I don't want to harm them. And so I didn't do that. And I'm glad that I didn't, because then I might have gotten infected with COVID.
Mhm.
So for all of you out there who haven't seen people, or whatever choices it is that you are making, thank you for making good choices. So our next question is, and have you experienced any changes in access to mental health care? Um, we had several programs on health is queer resistance where we brought in mental health experts to talk with people about how to survive these times. Katie, do you want to say anything about that?
Sure. Yeah. We had a number of people on that I remember, and really a fair amount of everything we've covered, even if it wasn't specifically targeted towards stress, was it somehow gave you a little tidbit about how to hang in there during these times. Um, some of it was centered around immune support. I remember giving a COVID talk right at the beginning when everything first hit, and some 40 some slides or something, just so that people understood the immune system and how to support it. Um, and then we had people talking about we had yoga and different restorative options, and how you could join live classes that were free or at least really inexpensive and available virtually. We talked about a number of other coping mechanisms. We had some people talking about self-help books and breathing techniques and things of that sort. And then I can't recall how much in depth we went with that psychologist who, whether they were able to provide other resources outside of just contact to their individual practice or not. But in case anybody doesn't know, there is a site for finding therapists or psychiatrists or psychologists. And psychiatrists are the ones that can prescribe you medication. And it's just Psychology Today. And it's a very comprehensive different search engine system that you can use, and you can pick and choose what type of provider you want to see. You filter for your zip code, filter for your particular issues, filter for whether you have insurance or not, those types of things. And you can tend to find a number of healthcare providers there, read their bios, see who you vibe with, just in case anybody doesn't know about that resource. There's that.
And also, if you go to www.equalityarizona.org/resources, we put together a list of resources. Some of them may have changed, but there are quite a number of resources for mental health there that you may be able to find if you're in need for that.
Okay, so the next question is about how connected you feel to your community.
Okay, and we did one last question. In 2020, how have you connected with Equality Arizona? This is really important because, I remember, uh, I remember the day that I wrote a little note to our executive director saying, hey, we ought to be paying attention to this COVID-19 thing. And then that very afternoon, I got an email saying that we were working from home and we had to figure it out. And so, in my opinion, we have done incredible work throughout this pandemic, whether it's panelist, whether, you know, it's moving our queer poetry salon to digital realm. But we also want feedback from you about how you are interacting with us, how you're finding out about us, how you have, you know, did you find us on social media? Did you receive an email, a call, or a text before the election? Is it through the Queer Poetry Salon? This is going to help us to know how to tailor the programming that we do, so that we can reach you in the way that is going to be best for you. And this is very, very important information for us. So please make sure to fill this one out. Jean, thank you so much for joining us tonight and for putting together this incredible survey, and for the foresight that it took to seek out this kind of information.
Yeah, thanks for having me here tonight.
Jean, didn't you come through a Health is Queer Resistance meeting? Was that your first interaction with us?
You know, I think it probably was.
That's awesome. But when we were still in person over at the McKinley Center, I think, right? I think I remember you coming in and then you got involved. So everybody be like Jean.
One of those, or one of the poetry salons, I think.
Oh, Either way, fantastic.
Yeah.
We had a question. Are you on any of the alternative social networks? I'm concerned about Facebook's future.
We're also on Twitter.
On Twitter.
And on Instagram as well. Yeah, we can you post those tags in the chat for us, Jean? The Instagram and the you're asking great questions, Aaron. Thank you very much for being with us tonight. We miss being able to talk directly with folks. We have to be very careful with our video programming. We had a couple of bad experiences with Zoom bombing at the beginning of the pandemic, and so we use this sort of format now where it's just us talking. But we can't wait until the moment where we are able to get in touch with people in person again one day. And so thank you, Aaron, for sharing all the information that you did about what you're going through. I'm sorry that you're completely isolated out there. I think that there's a lot of us that are feeling that way. I know that I am. I mean, I myself, I moved to Flagstaff so that I could go to graduate school, and I don't really know anyone here, you know. So I am trying to take personal responsibility for myself in this pandemic. So I've been intentionally not really seeing too many people. But you know, I think that for myself, the way that I look at it is that I'm Native and French, and my tribe was absolutely decimated by pandemic after pandemic, over and over again. I mean, it was one of the main ways that we became a tribe of only about 1,200 mixed race people. And the history of pandemics in the United States is no new thing. You know, there have been pandemics here for a long time. And my feeling is that, you know, it's really terrible what we're going through. But I feel like this is a moment where we can build resilience and we can build strength as a community. I know that I have my moments where I wonder how I'm going to keep doing it. And I'm sure that everybody else out there has had those moments, but I want to thank everybody in our queer community, gay, lesbian, trans, non-binary, however you identify, however it is that you feel about those terms as well. For all of the moments where you have stayed resilient and continue to persist through this, thank you for doing that, because we really need you. We care about you. We care about you. And we're very concerned about the well-being of our community. So please go ahead and fill out that survey. Jean is also going to post a link to a couple of events that we have coming up this week. One of which is I also host a queer poetry salon. I'm so proud of the work that we do with that poetry salon. We started off in my bedroom, basically, or not my bedroom, but my living room about a year and a half ago, around the same time that we started this programming. Since then, we have partnered with the Virginia Piper Center at ASU. And this month, we're bringing Tommy Pico and Jake Skeets and Smokey Sumac, all of which are award-winning Indigenous poets, queer Indigenous poets, queer and trans Indigenous poets. And, you know, in Arizona, we have a large Indigenous community. And our Indigenous communities here are often underrepresented, even though those tribes that are from Arizona were the first people here. And so it's been my personal goal to try to give as much Indigenous representation in our queer, trans, and two-spirit communities here in Arizona. Do you have any, Katie? It's so good to see you. I wish that I really miss being in Phoenix, where I could go and talk to you or have a Boca Burger or whatever it is with you. Do yoga with you.
That'd be awesome.
I miss those times
Me too.
a lot.
Yeah.
And I also want to acknowledge Danielle Lewis, one of the board members of Equality Arizona, also a naturopathic doctor who, when the pandemic started, came on for several programs. And then we've been working with Lindsay Love. We miss them. You know, Lindsay wasn't able to come on tonight, but we miss her. We hope she's doing well out there, and we miss seeing you all. Do you have any closing things that you'd like to say?
Oh, I'm so happy for everybody that's joined and for people that are watching later after the fact. I know that we get a lot of views after we have the programming, so hi to all of you too. Equality Arizona is always here for you, and hopefully you reach out, and whether or not you get involved, at least, there's a community there waiting for you to, with open arms, virtually, at least for now, as friends and support. And if anybody needs any, naturopathic medical attention of any sort, feel free to follow me or message me on Facebook. My LLC and my tag is Inclusive Natural Medicine. So I'm here as well, even if you have a question and, you don't want to establish care, that's fine. I'm here for you as a support. So I think that's it, Tanner. I mean, I've loved these meetings, and we'll have to see, how it evolves over the year and everything. But definitely miss you too.
If you put the link in the private chat, Katie, to Inclusive Natural Medicine, Jean will post it Jean will post it on our comments. That way people can reach out to you.
Sure.
That's one thing that we like to try to do is, we have volunteers who work with us, and we try to support their businesses and their practices. We try to support our poets' books. I also want to mention that tomorrow we have a town hall on conversion therapy. I know that it's one of our main goals at Equality Arizona is to ban the practice of conversion therapy in Arizona. It's a brutal practice. I personally had a partner who experienced that, and it continues to be detrimental to their life 25 years after it happened. And if you are a person who's experienced conversion therapy, I'm very sorry that that someone out there had the thought to do that. I'm very sorry that happened, and we are working to end that practice in the state of Arizona. And I just, you know, I want to say one more thing about volunteering before we move on. Like I mentioned, Katie was just the person who came to, well, I mean, Katie's much more than just the person who came, but Katie came to one of our events and became a volunteer. And, you know, the work that we've done together has really evolved. And Jean, you know, who's now an employee at Equality Arizona, showed up at a Health is Queer Resistance meeting and then started reading her beautiful, she doesn't beautiful, but she's an amazing poet. And she would do her poetry at the Queer Poetry Salon open mics. And then she started helping us with our website. And then she's done incredible work and is now like one of our most pivotal members of our team. And I'll tell you a little story about me. Years ago, I had a degree in music, and it was worth less than the piece of paper that it was printed on. And I started volunteering in Louisiana at a little organization called Acadiana Cares. And I worked in a home for people who were living with HIV. That was my first job with them. And then I basically had a career for a number of years working in HIV. And so you never know when you volunteer what sort of opportunities are going to open up for you, not necessarily with the organization that you're volunteering for, but you meet people and you interact with people and you start making a difference in the community, and people start seeing that and they start noticing it. And opportunities come to you when you bring opportunity to others. That's just sort of how the law of the universe works, I think. And so we need your help. We need your help. All of the links are there in the comments and in the chats for you. Please volunteer with us. Thank you so much for joining us tonight out there. And, you know, say hi, tell us who you are. We can still read the comments after this broadcast is over. We appreciate you very much. And with that, this is Health is Queer Resistance. Thank you so much.